On March 3rd, my sister and my parents left for the hospital in the early hours of the morning. No, it wasn't an emergency, although it was as nerve-wracking as if it was. It was a planned appointment for my sister, Emmeline, because her scoliosis had gotten to the point that her back brace couldn't fix it anymore. She needed to have a spinal fusion surgery. What is a spinal fusion surgery and why is it important? Well, if one has scoliosis and that person's curve gets to a certain point, then it could probably be recommended that that person has a spinal fusion surgery. It is good to know that if you have a scoliosis, what could happen if you don't do for it what it needs. I, having scoliosis myself, know what it's like to feel a little off balance and have pain in my back because of my scoliosis. Even though I will most likely never get to the severity of needing a spinal fusion surgery, I was with Emmeline through most of the recovery process and was enlightened to what it might be like if I ever did get one. In this speech, I'll be covering at what point someone with scoliosis needs to get a spinal fusion surgery, what happens in the operation room, and what the recovery process is like. First, I'm going to start off what it's like to have scoliosis. When my sister turned 6 years old, my mom noticed a curve in Emmeline's back. Because my mom and her siblings had scoliosis, and scoliosis is a gene that is passed down most of the time, she took Emmeline and me to the doctor to check our backs. We learned that we both had scoliosis, a condition where one's spine curves in an unnatural way, making a C or S shape when it should look like an I. We were both given a back brace. As we were both still young, we were both growing, so if we wore the back brace for 18 hours every day, then our spines would ideally grow with less curvature. Though, as children, we didn't realize the severity of the situation, so most of the time we didn't hit our 18 hours. Once we stopped growing, and if our curve was past a 50-degree angle, gravity would begin to pull down on the curve, making it larger and causing more pain. If the curve is in the upper back, then it can cause issues with shoulder pain and lung and heart functions. If it is in the lower back, then it can cause issues with digestion and childbirth. Emmeline had her curve in her upper back, and she was already experiencing pain in her shoulder. Emmeline's curve was just over 50 degrees, and she agreed to a spinal fusion surgery because she didn't want to be in pain for the rest of her life. Now let's turn our attention to what happens in the operation room. During Emmeline's 5-hour surgery, she was unconscious because they put her under general anesthesia. For spinal fusion surgery, surgeons must make an incision where the curvature is and fuse the spine using bone graft, which is bone that someone donated or the patient's own bone. If the bone graft comes from the patient, then usually the surgeons take it from the pelvic bone. For Emmeline's surgery, they used donated bone graft, and they used some of her own bone taken from her pelvis so that her body would accept the donated bone and wouldn't try to attack it. Soon after the bone graft was in place, the surgeons placed bars and screws in her back to further stabilize her back. As stated in Healthline.com, the added stability provided by the plates, screws, and rods helps the spine to heal faster and with a higher rate of success. Once one has finished their operation, they are taken to the recovery room. So let's now look at what the recovery process is like. Emmeline spent 3 days in the hospital. During that time, she needed to find her new center of balance as her position was straighter than it was before. She described it as very uncomfortable and that her upper back felt sore. She slept half the time she was in the hospital, which is common for these types of surgeries. She had an IV in, and she was able to take pain medicine as needed by clicking a button. When she got home, she had to take oxycodone and cyclobenzaprine for the soreness in her back. The soreness probably stemmed from her back being stretched when her spine was straightened. She came out of the hospital about 1 inch taller than she was before, finally beating me in height, as we've been the same height ever since we were little. I am now officially the shortest sister of the family, even though I'm the oldest. Anyway, Emmeline couldn't do very many things after her surgery. She had to learn to stand up by herself, adjust herself when lying in bed, get out of bed by herself, lift her hands above her head, lean over, and sit or stand for a long time without support. Most patients with spinal fusion surgery in the upper back must slowly adjust to these everyday things, just like Emmeline did. But for patients with spinal fusion surgery done in the lower back, their experience would be much more life-changing. It is more restricting for the patient's movements because it fuses the working part of the spine, making it more difficult to twist and bend. Luckily for patients with upper spinal fusion surgery, the only thing that they wouldn't be able to do is tackle football and a few yoga poses. To recap, we covered at what point spinal fusion surgery is needed with someone with scoliosis, what happens in the operation room, and how spinal fusion patients recover after their operation. Overall, if you hear about spinal fusion surgeries and scoliosis, you can think of me and my sister, as I am still twisted and she's not that twisted anymore.